Atul Gawande's The Checklist Manifesto, How to Get Things Right is a book about how something as deceptively simple as a checklist can transform complex fields of work. Gawande, a surgeon, begins by grounding the reader in the world of modern medicine, where expertise has expanded dramatically. Doctors, like professionals in other fields, face more knowledge and technology than one person can reliably keep in mind. Yet even the most skilled practitioners make avoidable mistakes, not out of ignorance or incompetence, but because memory and attention are fallible under pressure. This is the tension at the heart of the book. Expertise has never been higher, but mistakes persist. To illustrate this, Gawande recounts stories from the operating room where small oversights led to infections, complications, or near disasters. What stood out was that these were not mysteries or novel problems. They were preventable lapses, like forgetting to wash hands, overlooking a piece of equipment, or failing to confirm patient details. These mistakes happen not because professionals are careless, but because complexity creates too many moving parts. His question becomes, is there a simple tool to help experts get the basics right every time? Gawande finds answers in industries outside medicine. Aviation, for example, faced a similar challenge when aircraft became too advanced for pilots to manage purely by memory. The solution was the checklist. Pilots adopted step-by-step lists for takeoff, landing, and emergencies, and aviation safety improved dramatically. What struck Gawande is that checklists didn't replace expertise, they supported it, freeing mental bandwidth for judgment and adaptation when unexpected problems arose. He extends his investigation to construction, where skyscrapers are built by coordinating thousands of tasks across dozens of teams. Construction managers rely on intricate checklists to ensure nothing is overlooked, and communication is consistent. This system doesn't just create order, it builds reliability. No matter how complex the project, the checklist makes sure the fundamentals are never forgotten. For Gawande, the lesson is clear. The right checklist empowers teams to manage complexity without stifling professional skill. When Gawande brings this back to medicine, he focuses on the World Health Organization's Safe Surgery Checklist, which he helped develop. It contains seemingly obvious steps, like verifying the patient's identity, ensuring anesthesia safety checks, and confirming that all surgical tools are accounted for. Many doctors resisted at first, believing such reminders were beneath their expertise. Yet when hospitals tried the checklist, surgical complications and deaths dropped dramatically. Something as straightforward as confirming aloud that antibiotics had been given or that blood was available in case of bleeding made a measurable difference. The storytelling in the book becomes vivid through anecdotes of how the checklist saved lives. Gawande describes cases where surgeons faced unexpected bleeding or equipment failures, but because they had already prepared through the checklist, they were able to respond calmly and effectively. The power wasn't in eliminating surprises, but in giving teams the confidence that they had covered the basics, allowing them to focus on the extraordinary challenges. Importantly, Gawande highlights the cultural resistance to checklists. Professionals often pride themselves on autonomy and mastery, and many bristle at the idea of following a list. He admits he felt the same way at first. Yet the evidence forced him to reconsider. Checklists are not about questioning expertise, they are about recognizing human limitations and designing safeguards against them. In high-stakes fields, humility in the face of complexity becomes a virtue. Another dimension of the checklist is communication. In operating rooms, the checklist requires every team member to introduce themselves by name before surgery begins. This small ritual flattens hierarchy, making it easier for a nurse to speak up if they notice a problem. Gawande shows that the checklist isn't only a technical tool, it is also a social one, creating an environment where collaboration improves safety. Throughout the book, Gawande balances data with narrative. He presents studies showing reductions in infection rates and surgical complications after checklist adoption, but he also weaves in human stories of patients who benefited. This dual approach reinforces his argument. The checklist is not abstract theory but a practical, life-saving intervention. He insists that it is precisely its simplicity that makes it powerful. One striking theme is that mistakes rarely come from lack of knowledge. Instead, they come from lapses in execution. Gawande argues that in our era of specialization, mastery requires not just knowing more, but building systems that ensure what we already know gets applied consistently. The checklist becomes a tool of discipline, bridging the gap between what professionals intend and what actually happens under pressure. He also explores the limits of checklists. They cannot anticipate every scenario, and too much detail can make them clumsy or ignored. The best checklists are concise, focusing on critical steps that are most often missed. Crafting them well is a skill in itself, requiring an understanding of where failure is most likely to occur and designing prompts that are clear but not overwhelming. Gawande's personal reflections bring warmth to the book. He shares his own initial skepticism and his experiences testing the checklist in surgeries. He admits to moments where the checklist seemed unnecessary, only to realize later how it had prevented a dangerous oversight. These candid accounts show the reader that adopting a checklist is not about surrendering expertise but about being honest about fallibility. The book expands its scope beyond medicine. Gawande shows how hedge fund managers, disaster response teams, and other high-stakes professions use checklists to avoid errors. Each story reinforces the universality of the principle: no matter how skilled, human beings are vulnerable to oversight and structured tools can safeguard against it. By the conclusion, Gawande positions the checklist as a symbol of modern professionalism. True expertise is not just about knowledge or technical ability, it is about acknowledging human limits, creating systems that compensate for them, and embracing tools that improve reliability. He suggests that this kind of humility, combined with discipline, is what leads to excellence in complex work. Ultimately, the Checklist Manifesto is not just a book about medicine or aviation or construction. It is about the power of small, structured interventions to make a disproportionate difference. Gawande's storytelling makes clear that the checklist is more than a piece of paper. It is a way of thinking, a recognition that in a world of increasing complexity, success depends not on trying to remember everything, but on building systems that help us remember what matters most.